All right. Well, I think we will get started. We have a lot to cover today, a lot that we hope to cover, and we really are looking forward to your ongoing engagement with the Moving Forward Coalition. So my name is Alice Bonner, and I'm the chair of the Moving Forward Coalition, speaking with you from beautiful, freezing cold Boston today. And I followed my mother's advice. It's a cold day here, so I put on a bright pink sweater to try to get through the day. But, thank you all for chiming in, as many of you have, in the chat, putting your name and your location, your organization. If you'd like to do that, that's great. We're recording the call today because these coalition conversations are really intended for anyone and everyone who would like to learn more about what we're doing with the coalition. And so, we will provide the opportunity for people who were not able to join today to listen in. So just wanted to point that out. I want to start personally by thanking everyone on this call, because many of you are already doing some sort of work with us as the coalition. Some of you, we have committee co-chairs on this call. We have steering committee members. We have nursing home residents. We have advocates. We have, other groups like long-term care ombudsman and others. So I would just, again, invite anybody who's already working with us who wants to make comments at all. Please think about doing that at some point during the conversation today. I also, as I said earlier, I just want to thank Erica Hornstein, who's our program and engagement specialist, for being on the call. And Erica may jump in from time to time because I can't read the chat. And I'm going to share some slides in a few minutes, and I won't be able to see the chat. So any questions that are there, she will read them to me or interrupt me so that we can address them. I also want to point out we have a couple of people on this call who are from the John A. Hartford Foundation, who has, that's generously funded this work. So Dr. Terry Fulmer, President and CEO, is on the call, and so is Dr. Jane Carmody, who's our program officer. And Jane, I just want to stop for a moment and invite you, if you want to unmute yourself and just give a few welcoming comments to the group today.
Well, I will, but if we have our president, Terry Fulmer, I would invite her as well. I'll do a few and then turn it over to her. But I have to first of all note, Alice, I'm kind of dressing like you today.
Yeah, that's good.
I think we kind of look good, like we're together on this. Let me just say a few words, as Alice had mentioned. So Jane Carmody, I have the privilege of serving as a senior program officer for the John A. Hartford Foundation on behalf of Terry Fulmer, our president, and Ronnie Snyder, our vice president of program. We want to thank you for all the work you're doing, as well as for attending today. We also have a couple of our own program officers on today. I think I can see Nancy Wexler's on, and she can kind of give a hello, as well as Iru Pan, who's one of our newer grad students and just couldn't wait to learn more about this information. So she has joined as well. We're excited about that, and I'm sure they'll chat in their info. Just a note, our foundation is a national philanthropy. We're based in New York City and fund nationally. Our mission is to improve. Our only mission is to improve the equitable care of older adults, no matter where they are, no matter the setting, and no matter who is providing the care and protecting their health. We are proud partners with the Moving Forward Coalition, and love being here today to support the nursing home work. Alice, we can't express our gratitude enough for your leadership here, for Isaac, for the whole team, and we look forward to continuing to work with you. If Terry Fulmer is on the call, I do not see her, but Alice says she is. So Terry, please fill in the with hello.
And if she's not on yet, Jane, we'll circle back.
We'll circle back. That sounds good. All right. Well, thank you. Welcome, and appreciate all you do. Thanks,
fantastic. Thank you so much, Jane. And I just want to mention, because Jane mentioned, Isaac Longobardi is our associate director. I don't think he's on this call. He's not supposed to be, because he's on a well-deserved short vacation. So many of you have been on the phone with Isaac. You've given us great information, but he's the engine behind a tremendous amount of this. So we're grateful grateful for all that he does with all of you. So why do we have this call going on today? For a few different reasons. And this is a large audience. We had about 250 people actually sign up for this call, which is fantastic. We're thrilled. It's a variety of people. Again, some of the people signing in now, as you can see, are people on our steering committee or from professional associations and other groups. But we wanted to start today by giving just a brief overview because some of you have not been involved in the coalition. This might be your very first call. So we wanted to give enough background that you would understand the context for some of the things we're going to be talking about today, what we've done so far, our progress, our next steps, where we're going, and why we're doing this work. So we want to convey all of those things. We are still a pretty young organization. Just for those of you who you probably know that we've only been really actively engaged in the work since about September. So that's only about 4 months. So one of the things we do want to say today is, please join us, first of all, but also please be patient with us as we develop, because a lot of the work is just starting to happen now. So some of the things you're going to hear about today are still going to sound big picture, big ideas, general ideas, but we want to share them with you because they're important in going forward. I would just ask if everybody who's not speaking, if you can put yourself back on mute, that'll be great. That'll keep the background noise down. So if people could go on mute when you're not talking, that would be wonderful. Again, I want to reiterate how much we need everybody on this call. We need people also to talk with neighbors, friends, colleagues, other people you work with, to engage them also to continue to grow our group together. So that's what we're planning on doing today. Any questions or anything before I move to the slides, which I'm going to share my screen. It's going to go to black for a moment before you see the slides come up. But in a moment, you'll see the slide deck. And there we go. And again, this is all of the information that we want to share with you today, some of which you should see in the first couple of slides. So Erica, can you see the slides? Or Jay? I can see Jay. Can you nod if you can see the title slide? Yes. Okay. Great. So thank you, both of you. Again, this is in part today, we want to share what we've done so far, which, as I mentioned, it's still a young organization, but we also want to share our draft vision, our draft mission, and what we're doing with the action planning, which is the phase that we're in now. So we wanted to first start with the National Academies of Sciences, Engineering, and Medicine, or NASEM report. And I have my own dog-eared copy right here. It's never far from my side. And many of you have done the same. So this report is about the imperative for nursing home quality. We must do this and we must do it now. There's a real sense of urgency in this report. And what you can see here is the vision. And some of the people who were on this NASEM committee, the report committee, are actually on this call. And some of them are co-chairs with us at Moving Forward. So it said residents of nursing homes will receive care in a safe environment that honors their values and preferences, addresses goals of care, promotes equity, and assesses benefits and risks of care and treatment. Very broad statement, bold statement, and conveys, I think, a sense of urgency, and you'll see that continued in some of their other work. We wanted to share with you, these are the people who were on the NASEM committee, and it's important, I think some of you may work with these individuals, you may know them, you may read their papers, but it was a real mix of folks, although again, it was also a lot of people who do research in this area. One of the researchers is Dr. David Grabowski. Again, he's based here in Boston, and he is quoted very often by the people in the media and others. And he said, that the moment now is right, and the coalition can turn the recommendations in the NASEM report into real progress toward improving nursing home quality. The next 2 years and beyond, the coalition will work to create broad and sustainable change. And that this was, a quote that David gave to a reporter at one point and has given to others, but it really sums up what we believe also. We are building on incredible work that the NASEM committee did, bringing these recommendations forward so that we could really work on them together. And that's what this Moving Forward Coalition is about. So just the final slide on the NASEM report committee, the top 7 conclusions that they had are on this slide, but you really want to focus on the first one, which is why it's in blue there, which said that the way that the U.S. finances, delivers, and regulates care in nursing homes is ineffective, inefficient, fragmented, and unsustainable. All very powerful words. And the entire committee came together around that statement, that very powerful statement, because they wanted to say, we have issues that must be addressed now. And that's why the John A. Hartford Foundation and others came together and said, well, what can we do about that? How can we make sure that that actually happens? So that's why the Moving Forward Coalition was formed. And in terms of what we are, we're a group of individuals and organizations that have come together to drive specific and actionable improvements in nursing home quality while building a sustainable network to continue this vital work. So, a couple of things to point out here. This is about action plans and taking action now. And it is not a one-off. It is not something that we're doing now and then we're going to all go on to doing something else. We are doing this because we want to create a network that will be sustainable and will be embedded in the work that all of us are doing across our individual organizations, in political circles with political and legislative people, through advocacy, through work in the states, through local work in the states. And we have people on this call who are leading some of that work with us. So again, this is what the Moving Forward Coalition is and who's in this group. In the first 2 years, which is where we are now, our task is to identify both feasible short-term priorities as well as longer-term priorities that might take more planning and more time that can be turned into actionable initiatives. So again, think about something where it might not require a lot of additional funding, but it would be something related to care that we could test and implement in the shorter term. And at the same time, we recognize some of the recommendations from NASEM were about things like long-term care finance reform, which is a much longer, time frame that we're going to have to look at. So those are things for you to just keep in mind as we talk about this today. But I think everybody on this call, I imagine that whether you are a person who's living in a nursing home right now, you're the family member or care partner of someone in a nursing home, you're a CNA, a certified nursing assistant who works in a nursing home, a nurse, a social worker, a medical director, an administrator. These are all roles that are critical, and there's many others. And this is the work that we're all coming together to do. I would also say it's important to note that we're building on the work that you are all doing in your individual organizations and in your personal lives. We're not coming to this work and saying, we're brand new and we've got all these new ideas and we're going in a different direction. We're actually saying our role is to bring together and really build on the work that's already happening, which we have found out and we continue to learn every single day is incredible work that is going on. So what are we going to do today? As I said earlier, and I'll just reiterate here and give a little more detail. The first thing is the committees in the last 4 months have worked very hard to develop priorities. So they took the NASEM report recommendations, which were many, many pages. That report, by the way, is about 600 pages long. So they went through all the recommendations in 7 different categories, and they prioritized within each of those categories, either 1 or 2 of those recommendations that they want to develop into action plans. So those priorities have been posted on our website, which you can see the link is at the bottom of this slide. And actually, if you just put in your search engine, Moving Forward Coalition, it'll be the first hit that pops right up. So you can go to the Taking Action page, the subpage, and you'll see all 7 of the committees and their priorities. What we asked is we wanted to get feedback from everyone else that was interested. And so we put a feedback form on the website and we left it up for the month of December, and we got a lot of feedback. And we held 2 feedback sessions where people could join us on a Zoom call like this. And we had facilitators who went through breakout rooms and we got feedback that way. So the first thing is I'm going to share a summary slide of what was the most frequent feedback that we received on the priorities. Then we're going to share our draft vision and mission and a little bit about the strategic planning process to get, again, more feedback from you, because we really want to know how can we improve what we're doing. This is not a coalition where we say, you know, we know exactly what to do. That's not us. We are coming to all of you as members of this organization to say, you know, what do you think? What are we doing that's working well? What can we do more of? We recognize that right now, a lot of what we have is just the preliminary work, picking the priorities and convening the committees. We had to pick people for the committees and all of that. But now we're moving into the action planning phases. So we want to get some feedback about that. So with that, here is a slide that summarizes the feedback that we got on the priorities. Again, I know I don't have all the detail on the priorities, but you can look at them, you know, at your convenience. They're all posted on the website, and they're broken down by the categories that are the same as the categories in the NASEM report. Things like person-centered care, workforce or staffing, accountability, ownership and transparency, finance reform, quality assurance, quality measurement and improvement, and health information technology. So those are the general committee categories. So people said that focusing on person-centered care, or what we call resident-directed care, same concept, general concept, is very important across all the committees. And to truly know the individual, not just to be checking the box saying, I asked these questions and I know what this person's hobbies are and what they did for their occupation. Those things are important, but there's more to it than that. So the real resident-directed care preferences and priorities are important. Lots of people said the most important thing right now is staffing and workforce. And if you do nothing else, please, please, please help figure out solutions to the staffing crisis. And again, I know everybody on this call probably is familiar with that. But in addition to salary and benefit and adjusting compensation, which people said was very important, as we know, direct care workers' salary and benefits are quite limited in most parts of the country, but it's also about training and staff support. And in addition to the funding, really having good supervision, good management, good relationships. So leadership is also very important, but we know we need to focus on staffing, and we have a whole workforce committee. We may have some people on this call today from that group. The third bullet is about needing to focus on certified nursing assistants. I know I saw Lori Porter sign on to this call from NACA, which is a national association you may be familiar with lots of CNAs who are members. And in addition to CNAs, there's other direct care and other roles in nursing homes where it's important to make these jobs desirable. They need to be jobs that people want to do. So building a pipeline to focus on how to do more workforce development, specifically with direct care workers, is something we heard a lot of feedback about. The fourth bullet is the need to consider different staffing models. Nursing home staffing models that we see across the country now, as many of you know, are models that were developed a long time ago and based on medical models in many cases. And the buildings are older structures that are not really focused on resident-directed care. So small house models, smaller homes, the physical plant as being productive and promoting resident-directed care is very important. And so having the staff structure and support within that physical plant would be part of that. And then finally, the need for state and federal government agencies the ones that oversee, quality and safety, oversee regulations for nursing homes, need to be accountable for monitoring and overseeing nursing home quality and safety. And many of you, I don't know if we have any surveyors on the phone. I know we have at least one former surveyor, and so we appreciate your being on with us. But just, thinking through ways, how can we make any improvements in the survey process together? How can we work together on figuring out the best ways that government can be accountable? I was at CMS for 2 years. I was at the State Survey Agency in Massachusetts for 2 years. And I'll be honest, it's really hard work. It's hard to write regulations. It's hard to implement them. And so what can we do together to figure out better ways and build on the good things that we have already in those processes? So that's a quick summary. We have more details. We do not have this posted on our website yet because our steering committee and our co-chairs of our other committees are reviewing it now. We just shared it with them last week. So we will continue to ask for feedback. And if any of you want to give feedback, if you go to the website, we have a feedback form, and it just says, please give us your feedback, and you can just type in whatever you'd like us to know. And we read every single response. So please consider giving us your feedback as we go forward here. So this slide is our draft vision and mission. And I'll just read it for anybody who wants to hear us say it. So our vision is that every nursing home will be a community in which lives are nurtured, residents are empowered, and people want to work. And our mission is that we will make vital changes in policy and practice through the power of bringing diverse voices together now. And as you think about this, I will give a little bit of context, and Erica and Jane and others can jump in, and anybody from our coalition can add when we get to a discussion section, which is that, these are designed to be short statements that people can remember. So I want to be able to tell people what our vision and mission are if I'm away from my computer and I can't read it. I want to be able to say what it is. So we thought these were inclusive enough without being too long. We wanted to include the voice and the focus on nursing home residents first and foremost, and we also wanted to include staff. And people's feedback was, improving quality in nursing homes is everybody benefits from that. It's not just for the residents. It's also for staff. It's also for communities. It's also for public health. And many of you work in those different areas. The mission statement is inclusive of policy and practice because honestly, I think a lot of people have said, if we don't get to the policy piece, this isn't going to become a national, initiative that has scaled and spread. We have to get to policymakers. We need to convey what we do in nursing homes, who lives there, who works there, what's the nature of the home-like environment or lack thereof, and what can we do about that? There are a lot of people in Congress, in federal agencies, state agencies who know something about nursing homes, and there's other people who really don't. It just hasn't been one of their key priorities. So please think about this. And again, online, you can send us your feedback. I will make sure I put my email in this chat so that you can also email me directly with any of your thoughts and ideas, because we're going to be posting these at the end of January, but we'd love to get some more feedback first. The other thing is, you've probably seen this logo. We use it, throughout our materials, and we've gotten feedback from people that there are 4 focus areas and some cross-cutting areas that are important in this work. And so the 4 focus areas, and I'll go into a little bit more detail about each of them, are resident-directed care or person-centered care, the workforce, staffing, accountability, and finance or finance reform. Those are buckets that we got a lot of feedback, and it was, the frequency of the feedback and the depth of the analysis and conversation around those topics was really significant in a good way. And it made us think this would be a way that we could organize how we're moving forward in terms of our action plans. The other thing that would say is equity and quality are cross-cutting themes. No matter how we bucket the work that we're doing now with action plans, equity and quality are threaded throughout. The focus is on improving quality, and equity is something that's important across all of the work. The other thing that didn't come through in these 4 areas is something that a lot of people commented on, which is the use of technology. And I know we have Dr. Terry O'Malley on this call. I saw him join. I don't know if we have Dr. Greg Alexander as well, but they're co-chairing the Committee on Technology, and other people chimed in and gave us feedback about technology being something that should be somewhere. So we are not absolutely wedded to this design or these buckets or categories, but we do feel that we need some way to be very clear about the areas that we are going to focus on, because these are areas that are in the NASEM report, and they're areas that we got a lot of feedback about. And if there's anything else that you think should be part of this, let us know, because we are continuing to ask for feedback. So now I want to go into just a little bit more about why these would make sense in terms of the impact on nursing home residents, for example. So I just want to reiterate the point I made earlier. The impact is not only on nursing home residents, right? It's also on staff. It's also on communities. It's also on public health. It's on health systems and ecosystems, because nursing homes do not exist in a silo, or let me say they should not exist in a silo. They're part of a health system. So with resident-directed care, the benefit or the impact on residents would be that residents will have the opportunity and support to make choices that drive and shape their own care, experience, and life. And that ties back to the vision and the mission, I think. So again, this is what would frame the action plan development around resident-directed care. And we have a committee that's working specifically on that. So again, for you to think about and give us comments on. The next bucket was workforce or staffing, and the impact on residents would be that residents will receive care and support from a well-trained, caring, and consistent team of providers who are appropriately compensated. We know some of these things, a lot of these things are going to need compensation. They're going to need funding streams. We're going to need to figure out, okay, so how will we pay for these things? And I just want to be clear, we do acknowledge that, and we know that's part of this work going forward. How do we find the funding to support these ideas? Okay. There we go. Okay, finance. Benefiting the residents would be that nursing home residents will live in communities with greater privacy, dignity, and more consistent staffing. And I'll just share, we have a whole subgroup of people just working on organizational culture, and another group of people working on these topics that are, cross-cutting and cross-committee work. So we do have in development a crosswalk that shows how the different work that I'm talking about today is integrated, how the different committee work will integrate. And we already have pretty much all of the committees that are saying that they're working with other committees on areas where their work intersects and builds on each other. Accountability is a little bit broader concept, and this is going to take more work, I think, on all of our parts, but we would say that the impact on residents, or the benefit, would be that nursing home residents will know who is responsible for the care that they receive, and they'll be able to make choices based on that knowledge, and that they'll be able to trust government to monitor quality. So those are some different things in there, because accountability was a broad category that had a lot of different comments, but these are all things that we're going to be thinking about, and the committee that is focused on this work will be thinking about in their action plan development. And then finally, the cross-cutting themes, equity, quality, and technology, and that the benefit to residents would be that nursing home residents will experience improved quality of life and equitable care, and evidence-based technologies will support work in the 4 focus areas and across committees. So I know that's a very quick run through, and I want to reiterate again, These are draft concepts. They are for your feedback. We've gotten some feedback already, but we are really interested in what you and your organizations think about this, where we can make them better and build on other things if we've missed anything that you don't see included here. So just to recap very briefly, I made these points earlier, but now that you've seen some of the more detailed work that is in the planning stages, we are going to develop, test, and advance feasible, meaningful action plans based on the NASEM recommendations. We're going to demonstrate through the testing what works, what doesn't work, what we need to change, and we'll share those results. And at the same time, we will continue to build a sustainable coalition to continue the work now and for decades to come. We have our distribution list has about 700 people on it now, and it's growing every week. We get 20 or 50 or, we get more people signing up to participate. So that's great. But, we have 15,000 nursing homes in the country, 15,000 plus. And 1.5 million people who are working there and another 1.5 million who are living there. So we have more work to do to really build this out, but we're encouraged, that we've got that many people, pretty soon after starting up. So, last slide about our approach and outcomes for you to think about. We put a few projected dates here. And again, I hope we can hit these targets, but we set these goals for ourselves, which is, by the end of June, we will have 7 or more action plans that have been framed out and developed.
And Alice, could you explain a little bit more about what an action plan will look like?
Absolutely. Thank you, Erica. So the priorities, if you take a look at the priorities, they're general things, kind of like what I showed you here in terms of what the benefit is to residents. So it might say, residents will receive care in a way that increases privacy and dignity and enables them to make more choices. Something like that is a priority. An action plan would be, a group of us sitting down together and figuring out, so how would that happen? What would need to occur in order for that increase in dignity and privacy and choice? How would that need to happen? One of the things that's being considered right now, and again, if anybody who's working on this is on the call, you're welcome to chime in, is, for resident-directed care or person-centered care, it might be going to a group of maybe 3 or 5 nursing homes to start to test putting in place an actual process and policy and procedure around asking people about their goals and preferences and choices. And some of that will relate to dignity and privacy and things like that. But it would be actually creating a script that the staff member who's put in charge of that for an individual resident would follow, and it would ask specific questions of that person to be able to document in the EHR, in the electronic health record, or in the paper record, if it's on paper, document in the care plan, and then be able to take it through the process of, well, it's in the care plan, but is it actually being done in the care delivery reliably with that person? Because if that person tells us what their goals and choices are, we want to really, really try to make sure as consistently as possible we're addressing those things. So the action plan would be writing out all of those steps, going to some partner nursing homes, developing a script, developing trainings, figuring out who could lead that work with that in that small demonstration. How long is it going to be? 3 months, 6 months? Who's going to evaluate it? And then how would we imagine it being scaled and spread to more nursing homes, maybe in that state or maybe in other states? So hopefully that's a little bit of help in terms of the action plans will get very tactical and specific. Let me also just illustrate for a policy, for an action plan that's more about policy and not practice, it might be steps that are about connecting with policymakers. Who do we need to include? Which committees, if it's if it's a piece of federal legislation that's going to impact nursing home quality, that involves knowing who in Congress is on certain committees, who's chairing certain committees, if it's a piece of state legislation, and there's a number of pieces of state legislation. I know some of the people on this call have been involved with the Essential Caregivers Act, for example. That's federal, but there's also state legislation that also relates to caregivers, relates to resident family community councils, for example. So I would say the policy work is also going to be setting out a plan with a sequence of steps, but it'll be more on the policy side. So I hope that's helpful. Erica, did you want to add anything to that? Or is that?
No.
Okay, great.
There are a few people asking if these slides will be available on the website after the call.
Yes, well, we're recording the call, so the slides will be will be available with the call. We'll post them. The second bullet here is, by the end of September, we will have further developed and tested and advocated for at least 3 or 4 of these action plans. We may have more of them by then. But again, some of the ones that are more about policy are going to be a series of steps, and we may not have the testing all done by then, but we want to be well on our way. By October 31st, we want to have worked through some opportunities for co-funding, meaning, we have generous, funding from the John A. Hartford Foundation. We want to see, after the next 18 months, how can we, reach out to some other people who might be interested, other organizations, foundations, funding opportunities, so that we can continue to build on the work that we've started. And then, by the end of the year, by December 31st, we just want to make sure that we really are focused on, advancing equity and consistent quality throughout all of the work that we're doing. So we're starting now, we already have a group of people who work in the area of diversity, equity, and inclusion. We have a subcommittee that's working on that. But again, we want to really be sure we've got some results by the end of the year. So again, this is how we try to work. We set goals for ourselves. They're pretty bold, but that's what we're doing. And we know we need to do this because the urgency is now, especially with the staffing challenges we hear all the time. And you all hear as well, that there's really a need to move forward on these things right now. So the last is just a request, I guess, for all of you to say, when you're talking with people in the media, the press, trade journals, scientific editors, please remember to mention about Moving Forward Coalition, because we are still young, and there's a lot of parts of the country where people don't know about us and haven't heard about the Moving Forward Coalition. So it's really valuable, if you can mention it when it's appropriate in conversations that you're having, particularly with the media. And if you need materials or flyers or content at all for that, again, I know Christine Middleton from Word Circle Strategies is on this call today, and our communications team is great about that. And they love providing support in any way that they can. So again, this is the very last slide that just has my email and Isaac's email. So with that, I want to stop sharing my screen and go back to us all being able to see one another. And hopefully that worked. Jane, can you see me again? Yes, okay.
I sure can, yeah, great.
Okay,
Sure.
awesome.
Good.
So with that, it went to black again because I hit end show, but that's okay. With that, Erica, are there other questions or anything else from the chat that you particularly want to highlight? Otherwise, we're going to turn it over to the folks to make their comments.
Yeah, there are a few questions. Jay asks, does equity include needed support for urban and rural nursing homes that have high Medicaid populations that are struggling to provide care in some instances to younger and or more medically and psychologically complex populations?
Yeah, so that is a fantastic question, and thank you for that. So actually, about a week and a half ago, traveled down to New York City. Isaac and I both went to New York City and met with a group of younger residents of a particular nursing and rehab or home who wanted to talk about themselves as a population, and they were people from Black and Brown communities. There's a high percentage of Medicaid residents in this particular nursing home, and they wanted their voices to be heard. And it was we talked for almost an hour and a half. And they said a lot of the things we shared in the feedback. Staffing's a big issue. Staff training's a big issue. They want to be able to be outside of the nursing home. They want to go out into the community. So all of those things were just really valuable for us to hear. But your bigger point is, how do we know that when we're testing action plans in this work, that we're getting to the nursing homes that are representative, including representative of these, populations that may not be the typical nursing home population. People can chime in, anybody from the coalition, when we have started conversations with nursing homes that have said they're interested in partnering with us, and there's a number of them. We've started asking questions about, the populations that they serve, the, percentage of Medicaid residents, and others. So we are very focused on it. We need to continue to be really vigilant about it, because there's a potential for selection bias with nursing homes that speak up and offer to be part of this. And we don't want all of those nursing homes to look exactly the same. So your point about urban and rural is very well taken. There are unique challenges in each of those environments, and things we need to address that are different in those environments. So all of those things are helpful. And if you would like to stay involved, Jay, always glad to have you involved. But in particular on that topic, anybody who would like to, comment and stay involved in that, we're happy to have people. What else, Erica?
I also have a question from Karen about how could we get a skilled nursing facility to actually participate in an action plan.
So we're open to ideas on that. We have not gotten far enough that we've reached out to specific nursing homes about action plans. I will say a few of the committees have relationships, pre-existing relationships, because of related work that they've done. So they have opportunities to reach out to some nursing homes that may have an interest. But part of that is going to be working together so that those nursing homes are representative, as we just said. But I think we're going to probably have a call, or we're going to put out an email that's through our distribution list that we now have 700 people on. And we also have AHCA, Leading Age, and AMDA and NACA all on our steering committee. And we have relationships. I saw Cindy Froning from Nadana is on this call, and Nancy Tudor as well from Nadana. So we have ways of reaching out to some of the professional associations to also engage some of their members. And, we'll have a process by which we select, people who are interested and might be eligible. So Shannon Nelson, you have your hand up, I can see. Would you like to make a comment or ask a question?
Hi, yes, my name is Shannon Nelson, and I am part of a nonprofit group, Open Doors. I don't know if anybody has ever heard of it. And Vince is the director of Open Doors, and he put together Nursing Homes Lives Matter. And they have succeeded to making a task force for themselves, so that Kohler Nursing Home can be what they'd like to be, is like they stand up for themselves. And yeah, so that's what I just wanted to say. And you can look it up on either Open Doors or Nursing Homes Lives Matter.
Fantastic. Thank you so much, Shannon, for chiming in about Open Doors. And I see that Alex has already put in the link. So thanks, Alex. Glad you're on the call too. Open Doors is, was the group that we met with in New York City, and they do a lot of other work as well. I just want to take an opportunity, because we're talking about this, advocacy groups are critical in this work. We will not succeed without our advocates and without, nursing home residents and family members and care partners. But, groups like Open Doors, and there's many other out there that are really focused on the quality of life of, nursing home residents throughout the country. Very important. And Alex is one of their staff people who does a lot of this work. So thank you for that. Other points that people would like to make, again, I would invite anybody who's a member of the coalition who wants to chime in here, or anybody who's interested in just, joining the coalition now. That's all. It's all good. And we are, just really grateful for people's support and input and ideas. There are, yes.
Sonia mentioned that she wanted to encourage us all to ensure dementia inclusivity, particularly given the high percentage of people living in nursing homes who have dementia. And many people wanted to echo that.
Yes, that is a great point. Thank you so much for bringing it up. We are fortunate, I think, in that we have Doug Pace, who's member of the Alzheimer's Association, who's co-leading one of the work groups on quality assurance. And we need other people from other organizations as well, who are working with individuals who are living with Alzheimer's and family members who very often are called upon if, nursing home residents, become unable to, communicate in the way that they would like to, or become, their cognitive impairment gets to the point where they're not really able to say what their wants and needs are. But, it's really, really critically important that we focus on individuals living with dementia. In some nursing homes, the rates are over 50%, in a lot of places, sometimes over 80%. So it is a very significant subpopulation, absolutely. We also, again, because we mentioned, care partners a few times on this call, we do have a lot of care partners who have signed up for the coalition to be participants. I would say we have probably between 30 and 40. And Erica and I were just talking yesterday about possibly convening that group, maybe late January, maybe in February. But we want to be really clear about, how that group would take action, do local work in their state. We want to be really clear about what the opportunities are for individuals who are doing advocacy to come together and figure out, so what could we do together that would go beyond the individual efforts, of which there's many. So Christina Ramsey, you've got your hand up. Go ahead, please.
Yes, I'm a nurse practitioner in long-term care and have practiced 12 years. I actually started out in long-term care back in 1981, before there was even over-regulations. And I have seen nursing homes transform across the decades from a really sad, bad place to what it's now. And I can tell you, I'm very honored and privileged to be part of this coalition. I'm on Committee 1. I can tell you that this coalition has a lot of force behind it and a lot of support, and it's a very positive coalition. So we're moving forward in a positive manner as problem solvers. And so we take that approach, and I think that all the momentum of everybody on this call just helps foster that. I know that in the past, a lot of people have questioned, how are we ever going to make this happen in the nursing home industry? And it was one of the questions in the chat as well. And I think with all of you and all this great leadership, we can make this happen.
Thank you so much. That's, we appreciate so much the passion that everyone on this call brings to this effort. And honestly, we will not succeed unless we get everybody that we can engaged in this and feeling the urgency that we all feel, because otherwise something else is going to come in and, usurp what we're trying to do. I want to respond to two things that are in the chat. One is, someone asked about, how adopting health information technology in all nursing homes, like, what are we thinking about that? And Dr. O'Malley, since if you're still on the call and want to address that as in terms of the HIT committee, do you want to say anything about that?
Sure, Alice, and I'm laughing because when I hear people say that, adopt HIT in all nursing homes, it really is a daunting task. And so the question is, what, why? What is the HIT going to do that's going to improve the lives of the residents? And that's the issue we're sort of struggling with now. And that is to pick out 2 or 3 really critical functions that health information technology can address in a way that makes care more efficient, lowers costs, makes it more effective. And so we're actually starting out looking at how we can efficiently measure goals, preferences, and priorities, feed that into the care planning process, and then use technology to measure the fact that care provided actually is consistent with goals, preferences, and priorities. So that's sort of our priority, one of our priorities. And that's where we're starting. And I want to thank Maggie Calkins, who added a link on the personal preferences for living inventory. So that's helpful. So anyone else who's got suggestions about how we could start on goals, preferences, and priorities, please drop it in the chat or send it to me, send it to Alice.
Yeah.
We'll be happy to learn from it. Thanks.
Great. Thanks, Terry. And thanks for the question. There are 2 other people who've chatted in comments that I think are really important that I just want to see if they want to add anything. So Senator Moore, do you want to add anything to your comment that you put in much earlier, or anything else that you want to contribute here?
Thank you, Alice. Several researchers are very much involved. In fact, the press is also involved in looking at the financing of nursing homes. They have over the years, and this is a broad brush, so there's probably people who are not guilty as well as those that are, but the nursing home industry, in my opinion, has failed to invest in staff and in facilities. Over the years, they have not maintained, in many cases, good facilities. They're, as you pointed out earlier, they're a model that was built in the 50s for the most part, in the 60s, and not something that really will easily address the needs today. One of the issues we're dealing with in Massachusetts is that the Department of Public Health, as did, I think, the White House in their comments, suggested that there should be no more than 2 residents per room. And even there, they should be residents who choose to be together, not are just lumped together. Maybe potentially a married couple or a couple of friends or something. And the nursing home, not all nursing homes, in fact, the majority of nursing homes have accepted that regulation. But there's about 30 of them that have filed suit against the state to prevent it from going into place. I don't see, there's not only an issue of the transmission of illness like COVID, but there's also the need for privacy in order to provide dignity for the residents. So I think that's an area that we need to look at very closely. We also need to look at, as New York and as California have done. California is just starting this month, looking at consolidated financial reports, because the report of the individual nursing home oftentimes looks like they really need money. But why are people investing in nursing homes if there isn't a way to get a return? And it's because they're billing other parts of their own operation without a competitive bid, by the way, at any price that they want to charge. So they look like they're needy. And I'm certainly willing to provide some help there. I think it should be loans, low interest loans, perhaps, particularly for the privately owned facilities. Nonprofits maybe get a little better treatment, although there are some nonprofits that aren't necessarily all that good either. But most of them, many of them are. They're better, tend to be better on their quality than the for-profits. I mean, that's another broad sweep of information. But it's the problem with staffing now is not only is it a problem with quality, then many of the nursing homes are not meeting what the state, or certainly what researchers have said should be the staffing ratio for care. We've got dealing with a court case in Massachusetts where we think, and the Attorney General thinks, that the people higher up need to be held responsible as well rather than not just the direct care worker who doesn't have a lot of money and not getting trained, but how about the owners? How about the managers? Making sure that they're legally responsible. Otherwise, perhaps they're committing elder abuse in the process. So there are a lot of issues that need to be resolved. The one comment I would say on the moving forward steering committee, I'm a little nervous about the industry having a role on the steering committee. I think in order to have the report be trusted and actually to do the right thing, I think we have to look at what's their role on that. And so I'm looking at whether there's any conflicts of interest that hopefully we've tried to vet ahead of time, but probably will need to be vetted in order to make sure that the report results are trusted as good for the residents and good for the workforce, not necessarily good for the investors.
Right. Thank you so much, Senator. And, that's very helpful. And I just want to, for people who are listening to that, that was a lot of information, but all of those areas are being addressed in one way or another in terms of the accountability. You talked about the financing, you talked about the ownership, and the potential for conflicts and all of that. So we'll absolutely take that back. Thank you. I know that we've only got 4 minutes left, and I wanted to point out, Joanne Lynn chatted in something that we are working on with the coalition, and I just wanted to point it out that we have to get politically active in different ways, not lobbying, because we don't lobby, we're not permitted to, and we wouldn't do that, but there are ways that we can be active in terms of policymakers, informing people what's going on, being the voice of nursing home residents and staff people. So we have a nursing home resident on each of the committees in the coalition and the steering committee. Jeanette Sullivan-Martinez might be on the call today, but I know she was going to be. We have a CNA on each of the committees, and if somebody drops off for some reason, we find somebody else who can join. So we're really, really committed to that. And I just want to point out that that's part of, I think, what makes us somewhat unique. I hope unique. So I want to turn it over to Dr. Terry Fulmer because she has been able to join the call. I know she wasn't on right at the beginning, but Terry, do you want to say a few words to this group and add anything in terms of where we're going, our progress, but really importantly, where we want to go from here?
Thank you, Alice, and thank you for your incredible leadership, and to everybody on this call. This is a must-do moment. And the senator has said it very, very well. We just, there can't be any backslide. We can't let this get off the radar so that the nation goes on to the next problem and ignores what's going on for people who are in need of skilled nursing facilities. And I'm optimistic, and I'm listening. Alice and I probably talk every day, and that's not maybe twice a day. And so it's like, what are the levers? All of you need to keep saying, what are the levers? What are the mechanisms? We're going to save this chat and really work hard at addressing all of them. Here's something really good to end on. The National Academy's report was the third most downloaded report this year for the National Academies, and it only came out in April. So that just tells you people want this change. They want to be a part of it. Our foundation is 100% committed, and we're not going to let up. So back to you, Alice.
Thank you so much. And just again, a heartfelt expression of gratitude to the John A. Hartford Foundation, to all of you on this call. A heartfelt gratitude to Erica Hornstein, who is, again, absolutely critical in this work, along with Isaac Longobardi and so many of you. So I chatted in my email, and you can email me directly. You can also fill out the feedback form. Can be anonymous. It's all good. Your comments today are fantastic in the chat. We will save the chat, and we'll figure out about posting this and sharing it so people can have access. But everything you're doing is important. And as Terry said, the time to do this is yesterday, but we're doing it now, and we're going to make meaningful change together. So thanks all of you for joining, and we'll be in touch, and we'll look forward to the next coalition conversation next month. Tell us what you think we should talk about then. It'll be great. All right.
Well done, Alice.
Thank you. Thanks, everyone.
Thanks, Alice.